good evening and you are welcome to the Nuffield Health Convo Webinar, your #1 health talk that informs you, educates you, and helps you to stay ahead of your health. This conversation is brought to you by Nuffield Clinic, a specialist clinic in orthopedics, rheumatology, and physiotherapy. In simpler terms, bone, joints, and muscle. How is your joints? How is your bones? How are your muscles doing? Before we dive deep into our topic conversation, joint pain and stiffness, who should you see first? Is it rheumatology, physiotherapy, or orthopedics? I am honored to introduce to you our special panel, who are in the name of Dr. Mame Boatima Emisa Arthur. Dr. Emisa Arthur is a consultant physician, rheumatologist at Nuffield Clinic, and assistant VP and senior lecturer at Accra College of Medicine. We also have Dr. Samuel Kwashilati. He is an orthopedic and trauma surgeon. As well, we have Mr. Samuel Eyim Abua, the head of department for the physiotherapy department at Nuffield Clinic. My name is Priscilla Mametroba Akins, and I'll be your host for today's session. I am extremely excited to have you join us. Should you have any comments, any question, please put it in the comment section and our doctors will respond to it. All right, thank you. You are welcome to Nuffield Health Convo. Dr. Misatha, I would like to ask, okay, so aside from English, what other language do you speak?
I speak Tree.
Tree. Okay. Can you please describe or tell us what arthritis is?
Okay. So arthritis is a condition that affects the joints.
Okay.
So the joints in any body is what we call the moving surfaces, where you can, for example, bend your wrist, bend your knee, move your shoulder, and that's what facilitates movement. So if you have arthritis, you have a condition which is typically what we call inflammation of that joint. And inflammation will come about or will show when you have pain in the joint, when you have swelling in the joint, when you have other features like when you, temperature. So if you put your hand over that joint, it feels hot compared to the rest of the body. So simply put, arthritis is disease of the joints. And the joints are the parts of our bones that connect and move.
Doc, what is arthritis in tree, and how is my grandmom going to understand that not all joints problem is arthritis?
So there are different expressions of arthritis. Some people will say sasabro, some people will say ahututu. It also translates to rheumatism. So in simple terms, it is pain around a joint. As to how your grandmother will know that it is not arthritis versus it being arthritis, I think for that one, maybe then when she seeks medical attention, we will be able to define it further. But for the general person walking on the street, you hear them saying, "Sasabronaba," you know, or "Minya hututu," that sort of thing. And I'm a joint, me don't pay ya.
Okay. All right, Doc, thank you. We also have Dr. Latte, who is our orthopedic specialist here at Nuffield Clinic. I know Dr. Latte speaks Ga. Doc, what is arthritis in Ga?
Thank you very much. I was going to say, I hope you know how to say that. Speaking Ga, I don't think there's a Ga language. Typically, what they say, they also have rheumatism, that's how they call it. I've not come across a Ga word. But for my Gans, I mean, war here, we actually arthritis. So they tend to have joint pains, as we say. She mentioned it. They are conditions that affect the joints. A joint is where two bones meet. So whatever two bones meet and there is movement, we call it a joint. They tend to affect the joint, destroy the joint gradually over time. Okay, and that's the reason why we need to pick it up and then manage them.
Okay, Doc, is this the knee?
Yes, this is the knee. This is the knee joint. All right, and that's a typical joint. So if you look at it, it's made up of two bones. You see the white structures we see here. I don't know whether you can see when you look at it from the back. You see these white structures, one up, one down. So they are the joint, the bones that make up the joints. But the joint is not just the bones. Okay, on the surface of the bones, as we can see in there are structures we call cartilage. Those of you who kill goats, cows, and you see this white substance. Okay, the trees call it grey grill. When you chew it, it's grey grill. Yes, lining the surface of the bone. Now, this is what gives the joint surfaces smoothness and allows it to move smoothly. All right. It also acts as a shock absorber. Okay. Now, in the joint, it's not only those. Okay, there are other structures such as ligaments. There is a covering of the bone which you call the capsule. Within it, we always hear people talk about fluid in the joint. Yes, all of us have a little bit of fluid in our joint for lubrication. So there are structures in there which actually produce this fluid for lubrication. So when you take the joint, all these structures come together to form the joint. When we take arthritis, it tends to affect virtually all the structures. All right. There are different forms of arthritis, as we'll come to know. There are some of them that primarily will affect the cells that produce the fluid and get inflamed. That there are some too where the primary structure that is destroyed is a cartilage, the grill we talked about, and it destroyed. And that's what happens in most cases of arthritis. And once that grill is destroyed, the joint loses its smoothness, and then it loses its shock absorption effect. Then the bones now start feeling the pressure when you step on them. That's why they tend to get pain, worsening pain. Basically, that's what happens in arthritis.
Doc, at that point, if anybody seeks help at that point where the joint is weakened, is there a possibility that that person can come back to normal?
So, as I mentioned earlier, there are different causes of the arthritis. There are medical causes, purely medical causes. And I'm sure Dr. Mitata will speak about them. We have what we call a rheumatoid arthritis. That's a pure medical condition. So if you're able to control the medical causes, okay, you'll be able to control the pain. Unfortunately, it happens to a lifelong thing. Then there is also a purely mechanical type of arthritis, which we orthopedic surgeons tend to deal with. And that's what we call the osteoarthritis. There, the cartilage, the glue we talk about. Commonly, as you age, sometimes people who have had injuries to the joint that destroys that, it tends to degenerate. In common language, it wears off. All right. Now, when it starts wearing off, fortunately, you can't reproduce it. All right. But then we know when you pick it up early and we start management, you are able to reduce the rate at which the cartilage wears off. So yes, you'll be able to salvage it. A lot of the pain sometimes comes from the ligament and the other structures around the knee joint. So if we start the management, with good management, with good physiotherapy, sometimes the pain goes away totally and they're able to function normally, even though the cartilage doesn't go back.
Okay, your last point brings me to physiotherapy. As physiotherapist says, movement is medicine. We also have here with us Mr. Samuel Eyim Abua, who is the head of physiotherapy department at Nuffield Clinic. Mr. Eyim, I will find out. Movement indeed is medicine, but then at what point does arthritis worsen that there is the need for physiotherapy?
Okay, thank you, Madam Priscilla. Well, arthritis when it starts early age, as Dr. Alati said, it can, and you seek proper treatment or management. You see, you cannot treat it entirely. It's something that will be with you for a while. You can manage it. Okay, so when you start early and you seek treatment, it really gives you much relief than maybe waiting for the latter stage or when the condition worsen now. Okay. Yes. So when this what as a physiotherapist, when you come to us like that to do, aside dealing with the pain to reduce it, the most important thing is also to think of the muscles that really surround the knee. When you're talking of the quadricep muscle that you see here, okay, and the hamstring muscle at the back of your thigh. So when these muscles are very strong enough, they give stability to the joint, the knee joint, or whatever joint you are dealing with, depending the muscle around that joint, strengthening them. That will give stability and will help to reduce the pain, in addition to other modalities that will add to it for pain management. And we've seen a lot of patients who comes with pain, and within few weeks, their pain goes off, and then they can move and go back to their normal activity level.
All right. The 2nd February was World Rheumatoid Arthritis Day. Doc, we have started, Nuffield Clinic dedicated the month of February and March for arthritis. We want everyone to understand what arthritis is exactly and when you should seek help. Indeed, seeking help as early as possible is the most important thing you can do for yourself. Doc, we had an inquiry, someone asking that her child is 3 years old. But after following us with the World Rheumatoid Arthritis education we've been having on social media, she feels that her child has rheumatoid arthritis. Is it possible? 3 years.
Arthritis is a condition that can affect any age group. We've heard that there are many different causes of arthritis, and certain groups of arthritic conditions will affect certain age groups. So it is possible that a 3-year-old has arthritis. In a situation like that, what we would suggest is that the child is brought in and assessed. I'll just go back to basics and say, we discussed what arthritis is, but how do you know that you have arthritis? One of the commonest symptoms is pain in the joint. Arthritis often is a chronic condition. That means that when you get it, you have it for a long time. We have some that are what we call acute. So you'll get it for a few days or a few weeks and it goes away. That distinction needs to be made because so many things can cause pain in the joint. If a child was playing on a swing, you didn't see the child comes home and says, my knee hurts, and starts limping. Is that because the child maybe fell off the swing? Or is it because the child has an arthritic condition? So it always starts with what are the symptoms that the child or the person, the individual, is presenting with. Commonly is pain. Then you may have swelling of the joint. I mentioned earlier that the joint may feel warm to touch. In people who have lighter skin, the joint may look a bit red if your skin is fair. In those who have dark skin, it may actually go darker than your normal skin tone. So if you have a combination, you may also have stiffness. The joint will not move as easily as it normally does. So you have a combination of these symptoms, then it will alert the doctor or the medical practitioner to think that this is a condition affecting the joint. From that stage, then we will try and investigate what is causing it. There are common diseases that may affect joints that may not be arthritis. So for example, in a young child of 3 years, my mind may go to something like sickle cell disease. And we know that is common. We won't talk too much about it because that's not the focus. But I'm just trying to show that there are many other causes. We call them differential diagnosis. So we need to assess the person. If it is a middle-aged woman who comes to see me in the rheumatology clinic, I may think of rheumatoid arthritis or systemic lupus erythematosus. If it is a 70-year-old man who comes to see me or Dr. Latte, I may think of osteoarthritis. So there are certain disease descriptions of arthritis that may affect certain age groups more commonly than others. So bottom line is, yes, it could be arthritis, it could be something else, but importantly, we need to seek review and assess clinically follow on with laboratory investigations, with x-rays or imaging if we need to, and then we can be firm about what the diagnosis is and exactly what we need to treat.
What is the role of imaging when it comes to joints?
So imaging may come in different forms. We have the most common version, which is x-rays. Most people would have heard of x-ray. We could try x-ray. That looks at the bone. So it's able to use certain scientific ways to be able to give us an image, a picture of what the bone looks like. So as Dr. Latte had mentioned, if, for example, the cartilage in the joint, so in between the space, is worn away, on the x-ray, you see that the space between the bones is smaller. In very severe cases, the bones are actually sitting on each other. That is not normal. So an x-ray will show us that. We have other types of imaging that are called scans. So we have one called an ultrasound, or a more detailed one called an MRI, an even more detailed one called a CT scan. They all have their different roles, but some of these other imaging techniques will look at what we call the soft tissue. So not just the bone, but now we can focus on these areas that you see, the orange, the red, because they will not show on the x-ray, but on the scan we can see if there's a tear or if there's a fluid collection or if there's a swelling within the joint. So imaging will help us define our diagnosis better.
All right. Doc, I'll come back to you with lupus. Is lupus a type of arthritis? But before that, let me go to Dr. Latte. Dr. Latte, if I have joint pain, who should I see first?
If you have joint pain, who should you see first? I'll say see a doctor. I'll say see a doctor.
See the doctor.
All right? See a doctor. Usually the consultation will start from the general practitioner or the family medicine. Okay, they will look at you, assess your symptoms, and then depending on what they think is the cause of arthritis, they may direct you to either the rheumatologist or the orthopedic surgeon. But I mean, there is an overlap between what we do. The orthopedic surgeon basically looks like the structural problems with the joints. So they're kind of like osteoarthritis that are more structural. Or sometimes end stage of rheumatoid arthritis. Okay, that also end up with structural changes. There's a loss of cartilage, there is arthritis. You may end up still with orthopedic surgery. Whereas if it is more of the medical causes, like the rheumatoid arthritis, we were talking about lupus and other things that affect the joints, then the right place to be is with the rheumatologist. They all prevent differently. But basically, once you have joint pain, it's very difficult for you to tell what it is. So go to the hospital, see a doctor, and he'll direct you as to who to see. Or you can come to any of us. If you come to the orthopedic surgeon and we think it's a rheumatology issue, we'll let you see the rheumatologist.
I was about to ask, when do you refer to each other? When does orthopedic refer to rheumatology or physio?
So there is an interface in all this. The orthopedic surgeons tend to sit in the middle of this because they will all end up with a structural change. They will all eventually end up with the structural changes and will come in one way or the other, right? A lot of them in the worst stage will need some form of surgery or the other. So we do come in. But as I said, if the course is more medical, okay, then you see the rheumatologist first. So things like rheumatoid arthritis, which is the commonest, we'll be mentioning because that's the commonest. And it's more systemic. So that is what we call an autoimmune disease, where the body cells is reacting against itself. That is mainly treated with medications. So the rheumatologist is the best person to us. So when you come to me with a joint pain and I assess, and I think that is what it is, then I'll send it to the rheumatologist to handle the medical part of it. If there are any structural parts, I handle that. The patient may start with the rheumatologist. Okay, if she finds out it's basically a structural thing, osteoarthritis, we'll send it to you. If it is a rheumatoid arthritis and she's managing, and then she notices, okay, where we have structural changes that probably may require surgery, then she will also send to the orthopedic surgeon. Physiotherapy, we all do see physio. Because as I mentioned, apart from the joint structures, the cartilage in there, all right, the ligaments, muscles, they get involved. You tend to develop a lot of stiffness around the joint. Okay, and you need a physiotherapist to work on that. A lot of the time, imbalances in the joint. Okay, it affects the loading of the joint, and also that also worsens arthritis. Okay, and you need a physiotherapist to fix that. So they see basically everybody. We all would refer to a physiotherapist to strengthen the joints and then improve balancing and all.
Doc, you keep saying structure, structure, structure. My grandmom is watching. What do you mean by structure?
So when I say structure, all I mean is physical distraction to the structures in the joint that you see. So I talk about cartilage distraction. Okay, that is it. Sometimes it affects the bone. The bone themselves gets in very severe cases when the cartilage is all gone. The bone begins to scratch against bone. All right, that is it. Sometimes the ligaments get stretched out. Okay, some of them become contracted. All right, as part of the stiffness. They are all what we call structural changes. So those are the changes that physically will affect what you see with the joint.
Okay, let's go to physio. Mr. Yim, I have an example. Just yesterday, I was sitting behind my desk and I felt this sharp pain in my knee. Within 3 hours, like after 3 hours, I felt that same sharp pain when I was driving home. What came in mind was, do I have arthritis? And with this, Dr. Latte has made me aware that I can see any doctor, even a general practitioner. But I want to find out, can I see physio first and not seeing any doctor before physio?
Well, it all depends on the yes. I would say yes and no. Okay, yes, in a way. Okay, yes. If you go to see the physical therapist and examine you, and he says that no, you have to do further investigations, can refer you back to the specialist. Okay, yes, but if something like if say I say further, then we have certain things like red flags. Okay, if we examine and see that oh there are some red flag signs that then you have to refer to the appropriate professionals to also take care of that. So yes, you can first go to a physical therapist, and you can go later on. Physical therapy will also refer you back to when he examines you, assess you, and see that no, there are certain signs that I don't have to keep you, I have to refer you to.
Can prolonged sitting affect joints, attract arthritis?
Well, not attract. Actually, but it can, when we are sitting and you keep your body part or the joint in one state of position, okay, it's actually you weaken. Because if you are sitting, the muscle, the structures that we are talking about, they are not actively working. So it comes a time that you then feel like you are developing stiffness in that joint. So sometimes when you try to stand up, the first minute you stand, you feel some pain. You have to wait small or delay before you start to take some step, because you are now trying to the muscles or the brain that getting information when you stand up, then going to act to let the muscle then begin to contract and then become active. So then you start to move around. But because you've been sitting for too long and they are not working, you try to they try not to functioning to keep that stability the joint needs. Then it comes to that you start to feel that stiffness.
Dear desk worker, please try and stand
So
up.
it's always good that if your office or your desk you have space around before when you sit for a while like 30 minutes, you just sit here, you can stretch the leg up, straighten the knee, lift the leg up, okay, to work the muscles, activate the muscles, okay, before you then if you want to stand, you get up to stand after sitting in for prolonged duration.
All right. Thank you. He said it all. Dr. Mame Boatma, Back to lupus. Is lupus a type of arthritis?
Yes. So lupus is a systemic disease. We heard Dr. Latte mention it. We have different types of arthritis. Some of them are predominantly medical. We've heard the term structural, which would go to the orthopedics. Lupus is an autoimmune disease whereby the body is fighting itself. Same as rheumatoid arthritis. And we have other types of arthritis that fall within this umbrella of autoimmune disorders. They are systemic in nature, and when we say systemic, it means that it can affect any system of the body, the heart, the lungs, the kidney, the brain. And one of the major systems in the body is what we call the locomotor or the movement system. That's where the arthritis or the joint presentation comes from. So somebody with lupus can present with arthritis, but we also have some patients with lupus who may not have arthritis. They'll have kidney disease, or they'll have kidney disease plus arthritis. So yes, it is an arthritis. It is a cause of arthritis.
Dr. Latte, let's talk about gout. Looking at these feet, does the yellow parts, if I have pain at where the yellow indication is, can it be gout?
Can it be gout?
There's yellow all over.
Oh, yeah. That's it.
But I see it's mainly on the posterior side where you have the bigger joint. But when you take gout, we keep to say there are different causes of arthritis. Gout happens to be one of the causes of arthritis. Okay, we have things like we may have infections which we have not talked about. That's another group. Okay, and they are actually very dangerous. You need to attend to them as quickly as possible because they destroy the joint. But gout is basically uric acid. It's a product of metabolic, we call it uric acid. It tends to be deposited in joints, large joints. Okay, typically it tends to involve the joints of the foot, the big toe. Okay, just before you have the fingers, the big toe, the small joint. That's a typical place it tends to affect. But that's not the only place. It can affect any large joint. You see it commonly in the knee joints too. The elbows, the shoulders can be. Yes, the back here you have the ankle joints. It's not so common, but gout can affect. I mean, the uric acid can be deposited in any joint as long as the joint is a movable joint. It can't be deposited there. So yes, gout could cause that. And that's the reason why you need to come. There are tests we do, there are investigations we do, and they'll be able to pinpoint exactly what the cause of your arthritis is.
Physio, can rest worsen arthritis? Rest.
Yes, at the early stage of arthritis, if you always maybe you might have a low threshold pain. Okay, so little pain is too much for you, and you start to be lying down all the time. You weaken the muscles that really support the joint. And if you do that, then you try to quicken the process of the condition and become worsening as quick early. So resting at some point, yes, we can recommend that you rest for, but not for too long, maybe 72 hours. When in case you are in a very severe pain that you can't actually put a load on your joints at that stage, maybe it's good that we can advise or rest for maybe a day or two. Afterwards, you should start to work on your knee exercise or whatever joint you have to start the exercise. Okay, yes, so rest is not, you cannot say, it depends on the stage, the condition you are in. Okay, then you can recommend it, but for a short duration.
Okay. After this session, you will give us 3 different exercises that can help us to prevent joint pain. Yes, sure. Okay, Dr. Misata, please, your final words.
Final words. Arthritis is common, but there are also many causes of arthritis. Or rather, should I say joint pain is common, and there are many causes of joint pain. So if you have acute or very sudden onset pain, without any trigger. You didn't fall, you didn't have an accident, and the pain starts suddenly and it stays a while, please don't sit on it. Seek advice. If you have pain that has been present for a very long time, what we call chronic pain, similarly, there might be a cause for it. So also seek attention. Arthritis is also something that can be managed. Even though we've talked about damage and all of that, we can manage it. And so if it's managed well, you are able to lead a comfortable and a fulfilling life. Some people get pain and then they become isolated. They don't want to go out. They don't want to do anything. And then gradually, as I say, the world closes in on them. But if you seek help, physiotherapy, medical treatment, see an orthopedic surgeon for whatever indication is required, that may help you. Final points, as we've said earlier on, that even the babies or the toddlers can get arthritis. But the important thing I say is seek early intervention.
Seek early intervention. Right. Let's go for a quick commercial break.
Audio Jungle.
In a world where movement is freedom, pain can feel like a prison. But at Nuffield Clinic, we believe every person deserves to move freely and live fully. We are Ghana's dedicated center for specialized bone, joint, and movement care, committed to patients' trust.
Audio Jungle.
At Nuffield, we restore mobility through expert care and compassionate support. Whether it's a retiree seeking relief, whether it's a mother caring for her family, or an individual chasing peak performance, we meet you where you are.
Caring for our patients go beyond treatment. At Nuffield Clinic, we build trust through kindness, compassion, and clinical excellence. We are also here to engage with corporate bodies to help their team keep a healthy lifestyle to ensure effectiveness at work. At Nuffield Clinic, we don't just see cases, we see people, each with a story and a goal.
We focus on prevention, rehabilitation, and long-term recovery. Every diagnosis is thorough. Every treatment plan is personalized. At Nuffield, we believe in giving back to the community by championing a cause, restoring amputee children's mobility. We believe that amputation should not be a limitation. From Ghanaians to expatriate families, we embrace every culture with care that respects and understands. Because at Nuffield, we just don't treat physical conditions. We help restore the independence and confidence to live life on your terms. Nuffield Clinic. Move freely, live fully.
Audio Jungle.
My name is Priscilla Mametroba Akins, and I'll be your host for today's session. I am extremely excited to have you join us. Should you have any comments, any question, please put it in the comment section and our doctors will respond to it. Are there untold stories about arthritis?
Untold stories. There's a lot that goes on. I mean, a lot of misconceptions out there. As has been said earlier, osteoarthritis have different causes. The commonest we see as orthopedic surgeons is what called osteoarthritis. Basically, destruction of the joint, which starts with the cartilage. All right. People have it, and there are a lot of rumors. Okay, when you go to the hospital, they touch you, you can't walk again. You know that, and because of that, we have a lot of people suffering it. The point here is that osteoarthritis can be managed. Yes, it cannot be cured. Yes, we cannot reverse the cartilage change, but we are able to manage, and people live their full life. It starts with medical management, physiotherapy. There are times you see us giving people injections and other. They are not harmful. They are very, very safe. All right. I've had a lot of patients, and then sometimes when it's worse, we do surgery. is surgical management, which gives very excellent results. Okay, you do a surgery, a total knee replacement, total joint replacement. Survival is 20, 25, 30 years, and they are fine. I've had a lot of people for fear, a lot of rumors around them. Oh, when they touch your leg, you can't walk again. I know someone. We are all not the same.
Touch in terms of surgery.
Exactly.
Okay.
So there's a lot of fear for surgery, especially joint surgeries. But trust me, there are a lot of people. For every single complication you see, there are almost 1,000 people who have been treated who are fine. All right. So just come, let's evaluate. Don't be afraid to come to us. Okay. If there is a need, it can be managed and your life will be comfortable for good. Right.
Like if someone had an accident for about years ago, 5, 10 years ago, and now the person needs knee replacements or hip replacements. After the replacement is done, does the person get arthritis?
So after the replacement is a treatment for the arthritis. So when you get knee injury, hip injury, what happens is that the cartilage is hit during the accident and so it wears off. So they tend to get arthritis. So the replacement is actually treatment for the arthritis. Now, you say arthritis is the loss of a cartilage, isn't it? And when we do a knee replacement, hip replacement, we are replacing the cartilage. So there's even no cartilage anymore. All right. So that is not when you get arthritis. So it's actually treatment for the arthritis. There are other complications that can happen, but not arthritis.
But in the case that you do not get your knee replaced, but then what you how do I put it? Your knee was pulled to fix in.
Okay.
Do you end up getting arthritis?
So whenever, I'm sure you're talking about the dislocation.
Yes, dislocation.
Hip, it's not common with the knee, but the hip commonly, it gets dislocated. The thing is that once you dislocate a knee, a hip, your risk of developing arthritis increases quite significantly. Because yes, at the time it happens, you may have some injury to the cartilage. What happens is that depending on how bad it is, okay, sometimes the bones are involved. So what we call that stabulum, that's the cap of the hip joint, gets involved in destroy. So the anatomy, okay, or the structure of the joint is distorted. And whenever that happens, the risk of developing arthritis is high. So after every dislocation, the good thing is that when a dislocation is reduced early, it reduces your risk. The longer that dislocation stays without reduction, the higher your risk. You know that if you stay about 8 hours without a reduction, your risk of osteoarthritis just increases quite significantly. And so when you get such injuries, the point there is that get medical attention early. Let's get it reduced as early as possible. That reduces our risk of developing arthritis. All right. If it is not done well, it doesn't go very well. And of course, developing arthritis is quite almost sure. Right.
Doc, your last words.
My last words. Right. I think we've said it all. The basic point is that pain in the knee may be arthritis. There are different causes. The good news is that they are all manageable. There is one form, no matter how bad your situation is, there is management for it to make your life comfortable, for you to live without pain. Just come to us. If you have any misconceptions out there, always when you can, come with your questions. Okay, we will answer them and let you understand. The most important, nobody should stay with joint pains, arthritis. It can be managed and you will live a happy life.
Doc says, come with your questions. You can also leave your questions in the comment section and doctors will answer all your questions. Now to Physio, because Physio is coming to give us some exercises, he's not telling us his final words now. If you want to reach out to us, our numbers are 054 603 1126. 054 603 1126. We are located in Osu, Sunkwa Road, around the Salvation Army headquarters. Our physiotherapist, Mr. Samuel Eyim Abua, promised to give us exercises, some exercises that will help us with our knee, especially if you are a desk worker. So to my desk workers, right, Mr. Eyim,
Okay,
what are we doing now?
Okay, you're going to be the client. Okay.
Okay.
Just giving you simple exercise for after sitting for a long time and you want to get up. Okay, before you start to get up, just try to stretch, to make some movement like this. You straighten your knee, you bring it back. Stretch it, you bring it back. Okay, so let's go. Good. You can do this for a couple of repetitions for both. Okay, when you left go, yes. Okay. Yes, if you have still the space, you can lift the leg up. Okay, this you feel that your hamstring muscle is contracting, your toes pointing towards you. So bring up your flex. Does you flex it? Okay, you can hold it for 3 seconds or 5 seconds or 10 seconds. Then you bring it back, and then you start the other joint. Okay, like okay, you hold it for a few seconds. You bring it back. Okay. Then you can just get up easily, okay, and move around. So at home, you can also get some ankle or calf weight, okay. And if you want to still work for the quadriceps, hamstring muscles, you can just stand, try to bend in this way, okay, like this, bringing it up and down. Okay, if your stability is not good, you can go to support a wall. So one hand can support the wall, and then when you lift the other leg, okay, you bend it. Okay. So that is for your hamstring and for your quadriceps, and the range of motion for the knee joints. Okay, thank you.
Okay. Mr. Im, I want to find out, so in terms of posture, does your back, in case you are having back pain, can we say it's also boils down to arthritis? Can it end up with arthritis?
That depends on the part that is affected. Okay, yes, arthritis can also affect the spine. Okay, because there's a joint in the vertebral bones, the bones you see at the back. They also have joints. Okay, aside of you see the bone, you have also something we call it a disc in between. The other joint you call the facet joint. Okay, so all the joints, the bones, as you heard from our initial presentation, you see there's a bone where two bones meet. Okay, yeah, there's a joint, and the bone surfaces are all covered with cartilages. So yeah, so far as the bones around at our back, we call it the vertebral bones or the spine. Okay, yes, you can also have arthritis of it, but the term usually we use it for spondylosis.
So for us to understand the ligaments and spondylosis and how someone with back pain can say that, doctor can say you have back pain, but you have arthritis, or this is back pain, but you do not have arthritis. Mr. Yim will kindly illustrate this for us.
Okay, like as I said earlier, okay, yes, you can also have the back arthritis. Usually we use the term spondylosis. Okay, yes, this is our spine. Okay, the vertebral column, we call. Okay, yes, from your neck up down to the tail. Okay, yes. So you could see that this is the back. Okay, if you're standing, this is your back. These are the spinal process you see. Okay, so this is the front of a human being. Okay, yes. So you see that these are the bones, the vertebral bones, marked red. Okay, there's something whitish here in between the bones, what we call the disc. Okay, the vertebral disc. Okay. And the yellow thing that you see it here, they are coming from the spinal cord. The spinal cord is the yellow thing you see. It's run from the brain up, down, okay, to the lumbar L2. Okay, the spinal cord Just continue. Okay. So, and these are the nerve fluid. The nerve is eating. So this nerve supply from here, all that supplies our leg up, and this our hand, our abdomen, all this right. So if sometimes you might have a pain at your neck, but then you're having some pain around your arms, and you might think that, oh, why should I have? Maybe my hand is hurting me. No, maybe you might not even feel the pain in your neck, but still you have some pain around your arm. That could mean that can also result from something happening in your neck. Okay, that has referred the pain to, because the nerve coming out here might give supplies your arms. Okay, so when something is damaged, it can also have effect on your arm. Okay, the same thing, the lumbar region, even the thoracic region, you feel it. Okay. So when I was talking about, I mentioned facet joint. Okay, so that is the joint between, you see, this is one vertebral bone and the other. You see here, there's a joint here because this bone, okay, so there is a way that there's movement in all joints. Okay, so your vertebra, or there's still, though they move, yeah, you can bend, you can extend, okay, yes. So God made it in a way. So when sometimes some diseases affect it, it becomes very difficult to actually have this motion in the joints at your back. Okay.
All right, Mr. Im, this is Tiff. If someone with a hand like this, can physiotherapy help the person to be able to move correctly?
Yes. If depend on the other causes of why a joint becomes stiff. Okay, yes, it could be by trauma. Okay, it could be, yes, a trauma. Maybe you got a fracture, and then after either you were put into a cast or POP, and because it has been in one position, you want the fracture to join. After the bone has joined and the cast removed, you can make, maybe supposing the elbow joint, you find it difficult to extend it or to move, to flex it. Okay, so yes, when you come after removal of the POP, you come for physical therapy management, and we will help you go through certain modalities and exercises that will bring the range of motion back. Thank you so much. We've talked about the arthritis or osteoarthritis, rheumatoid arthritis,
Lupus,
the lupus,
gout.
Okay, gout, everything about arthritis. Our aim is to educate the masses that we want you to live a life as a normal human body. So when a part of your body is in pain, don't sit home, don't think that that's the end of you. Just seek medical attention and we will help you. Especially I recommend Nuffield Specialist Clinic, where we are one top-notch orthopedic facility. So always you can come with your joint issue and we are ready to serve you to your satisfaction. Thank you so much.
Right. Thank you, Mr. Im. Thank you so much for coming on this show. Once again, you are watching the Nuffield Health Convo, your #1 health talk that informs you, that educates you, and helps you stay ahead of your health. Today's session has been a great one. We have learned a lot. I have personally learned a lot. I believe you have too. Your comments are also going to be answered. Every question you have, do not forget to put the question under the comment section, and we are here to help you. Our doctors are available to help you. If you have any other question and you cannot put it on the comment section, please reach out to us on socials, on our website. We are always available to respond to you. Should you want to contact us, we are located at Osu, Sunkwa Road, around the Salvation Army headquarters. This is Nuffield Clinic, and our number is 054-603-1126. 054-603-1126. If you have your question in the comment section, we are responding to the questions as well. And should you have any topic you want us to talk about, do not hesitate to share with us. We will talk about it and we will learn more together. Have a good evening and thank you for joining. Enjoy your evening. Bye.